Lizzo. I don't even know what song she sings, but someone was talking about Lizzo's one of those TikTok.
So it's Lizzo. I know. So I have age
Can you
range.
sing the song for us?
Well, I know. I think it's lip gloss, hair toss, check my nails. I think it is. Because my girls listen to various music, and I know Lizzo pretty well. Not personally.
Yeah.
I know of Lizzo. I think she's a talent, and she's famous for many things. Not only her voice and her talent, but maybe her appearance. I'd say.
And I think there is a trend where we've gone from really shaming women who, from one end of extreme, were very anorexic looking models to obese women. But the thing is, the question isn't about her appearance, but is it healthy? To accept bigger size, plus size, okay. But from, let's say, as an obstetrician, is it healthy? Answer is no.
Yep.
And it's a dangerous influence, since these are influencers, to say you can be as big as you want to be, and as big as this young lady whose BMI is up there. And if she's ever considering pregnancy, then she has a lot of work to do before she should get pregnant, because of the risk of many things. When the obesity is involved, we're talking about early pregnancy loss, to during labor and delivery from complications that include gestational diabetes, hypertension, postpartum hemorrhage, you name it. And also congenital anomalies. There's so many. And I just have had issues with this particular TikTok where she was parading like she owned the world. Apparently she does. I'm going to hear her song one of these days to see what it's about. But I just think it's an issue. And I deal with obesity so much. I think I would say 2/3 of my patients are obese, maybe 1/3 in normal BMI range, but it causes a problem. Not only obstetrics, for GYN surgery, we are having to, for laparoscopy, instead of using this long of trocar or the instrument to get into the abdomen, we have to use longer just to get into the abdomen, which increases the risk of perforating very important vessels to bowels and whatnot. But it must also be an issue in pediatric world, right?
That's a huge issue, but it's a sensitive issue. And
Why? Why is it sensitive?
Well, it's how you approach things, and we have to approach things, and not to speak to specifically to her, but I come from a time initially where, it's all how you. I really believe it's all how you approach something. And there was a time where you saw like a young man in the office, I'd say, and they were overweight. This is before all the BMI discussions and all of the weight loss stuff. And there's a lot of stuff that's gone on since I've been practicing where they're big boned and they're big kids, and you don't really address it. We definitely want to address it. It's all how you address it, because you want to prevent. Like for me, it's such a continuum. It's tough to talk to an adolescent specifically about what their obesity will affect them later on, right? Because as an adolescent, you don't think about your mortality, you don't think about your heart disease, you don't think about your diabetes that could happen, but it can happen. And you go back a little bit to the younger kids who are overweight and how you address that. And you want to shame anybody, and you don't want to wave your finger at anybody. You want to support them. You want to get them to the place, whether that's the child, the patient, the adolescent, the young adult, the parent, to a place to make them healthier. Because I often say, I don't really care how you look on the outside. I don't care how your appearance is, but we do know that if you are overweight on the outside, that can affect how healthy you are on the inside. And the BMI is a number. It's a tool. It's a guide. It's not definitive. And not every overweight toddler is going to turn into an overweight adolescent or adult. But we want to prevent that because we know we want to prevent all the things you mentioned plus more. But yeah, how do we want people to accept and feel comfortable with how they look, but we also want them to accept that how they look could affect how healthy they are and their quality of life. So it's I get it.
Are you seeing a lot of obese toddlers compared to 10 years ago? Is it true? Are you seeing a lot of obesity in toddlers to young, the kids to adolescent? Is there a trend?
Yeah.
Because I feel like there is a trend in women.
Yeah. I'd say in my practice, I don't feel like seeing it anymore. But it's also in the eye of the beholder because there are just, because some kids, by their BMIs, they're obese, but they're tall and they're heavy, but their build isn't obese. But there are definitely kids we see who are overweight and they have too much fat. So, I think that the trend with Americans has been up. I would say over COVID in general. Maybe not to toddlers because their day-to-day is about the same, but for adolescents, we've probably seen more. But I tell you, what happened about 10, 12 years ago, if not a little bit more, was this whole BMI push. And you saw a lot of programs that started up to help kids lose weight. And some of the teaching hospitals, Children's Hospital, Mass General Hospitals have programs for overweight kids. I actually myself started a program years ago when this whole thing was happening. I was doing it with a good friend of mine who had a physical therapy practice, had athletic trainers. We hired a dietitian. And we were seeing kids 3 days a week on this program to help them exercise and eat healthy. We actually saw some changes, but it was tough for me to do both things. But back then, it was the buzzword. Overweight, BMI. And what this did was allowed us to go from calling kids fat or big boned or ignoring it and gave us the power to actually address it more because it was more out there without making someone feel bad. And the schools got involved too. So the schools were checking kids' BMIs on their health forms. They were noting it, and they were trying to incorporate maybe into their health curriculum. But it's out there. I can't say we've put a huge dent into it, but the conversation's more on the table. And it's a very, you're saying it's a very important part of healthcare, and it affects. Think about healthcare dollars that would be saved if people weren't overweight, and if we took better care of our bodies, preventing diabetes and high blood pressure.
Starts at your level, pediatric patients.
100%, 100%. And we talk about it. We talk about it at every visit.
Do you have a lot of young women? Because you see until age of 26, you said.
Yeah.
Young women probably abnormal menstruation, PCOS. You have a lot of those, right?
Yeah, so we have a good number. We know, and we have patients who are overweight and underweight, and those are the extremes and sensitive topics. And we want to support everybody. And you're right. Social media hasn't helped a lot with certain things. I do really feel that someone like Lizzo, who we're talking about, gives some support to people that this is who you are, but we should improve it. We should get healthier. Yeah, but we see a lot. We see the gamut of stuff related to weight, sure. But we talk about it.
And I think I remember the movie WALL-E.
Yeah.
I think that
not one of my WALL-E, the little robot guy.
Yeah, I feel like that's where we're headed.
In what way?
The whole world, population, everyone's becoming. Look. Look at the airline now. They have wider seats. The waiting room, instead of just one, now you have wider seats available. It's the trend. I don't see this reversing.
No, that's a good point.
And when we were at City Hospital, if I deliver 7.5 or 8, whoa, huge baby. Now it's 9 pounds, 10 pounds. And I think it's a trend that's just headed one way, and we're going to have to really address it.
Yeah, it's called spade a spade. You're right. We're overweight, overall overweight, right?
Yeah.
And you and I were decent shape, right? But it's overall Americans aren't the healthiest bunch.
It's not just America, because you know,
I know, yeah.
all the fast food chains have gone overseas.
100%.
If I see Korean, I'm like, whoa.
Oh yeah.
Who are these people?
Oh, yeah.
They're all eating Wendy's and McDonald's.
Yeah.
You know.
No, so you can extrapolate. No, it's out there, and it's a big deal. It's a big deal. And you think about quality of life, you know, healthcare dollars, even, you know, associated morbidities, comorbidities, as we say. You know, it's a big deal. But it's a topic that we address and we talk about it. It's not the. I often tell my patients the two toughest things. Actually, I had a third one on there, but the two toughest things to deal with, even in my office, and I see kids up to age 26. They're not kids anymore. Is overweight, losing weight, and stopping smoking. You know, but now it's actually vaping. That's a big deal. But it's. I think that we'd be silly. We'd be simplifying it too much if we just said, yeah, you got to lose weight. You know, that's, you know, it's easy. It's calories in, calories out, you know, whatever. But it's a lot to it, and you have to support people.
It's complicated, of course.
But you're 100%. I mean, you're 100% right. You know, we have to address it, and it'd be great. I mean, there's a spectrum of all kinds of things, right? There's a range, and there's you know, BMI goes from, you know, healthy BMI is third percentile, maybe to 90, not healthy, but 97th percentile, 95th, fifth to 95th. Right? That's a pretty big range. We want to keep people within that, because too light, too underweight, and too overweight is not healthy. So we got to get there.